Post-Deployment Cardiopulmonary Evaluation Network is a group of VA physicians with expertise in pulmonary and occupational medicine. We provide comprehensive clinical evaluations to veterans with deployment-related exposures and respiratory concerns or conditions. Through this work, we strive to better our understanding of the relationship between airborne hazards and longer-term health outcomes, identify possible treatments for related respiratory conditions, and improve care for veterans. Comprehensive testing is a key component of our evaluation, but we know that medical testing can be intimidating when you're not sure what to expect.
In this video, we will discuss advanced pulmonary function testing, including methacholine challenge testing, forced oscillometry technique, and fractional exhaled nitric oxide, or FeNO testing. Basic pulmonary function testing, like spirometry, is covered in another video. Non-invasive breathing tests that help your doctor see how well your lungs are working are called pulmonary function tests. There are many different types of pulmonary function tests, but all of them involve breathing in and out through a mouthpiece. On the day of your pulmonary function test, you should wear comfortable, loose-fitting clothing that allows you to breathe freely. You may be asked to avoid eating a heavy meal, using certain inhalers, or smoking for a few hours or even a few days before the test. Always follow your provider's specific instructions when preparing for your test. When you arrive, the technician will check your height and weight. The Methacholine challenge test is a type of pulmonary function test that helps your doctor understand how your airways react to certain triggers. Methacholine is a medication that, when inhaled, can cause the airways in your lungs to become slightly narrower if you have asthma or airway hyperreactivity. For people with healthy lungs, this dose of methacholine has little to no effect. At least 4 hours before your methacholine challenge test, you should avoid caffeine and vigorous exercise. Like with other pulmonary function testing, you may be asked to stop using certain inhalers, taking some medications, or to avoid smoking for a few hours or even days before the test. Always follow your provider's specific instructions when preparing for your test to ensure accurate results. During the methacholine challenge, a soft clip will be placed on your nose and you'll bite down on a clean mouthpiece and close your lips around it to create a tight seal. When you're ready, the technician will guide you through the next steps. First, the technician will ask you to breathe normally. Then, you'll be instructed to take a deep breath in, filling your lungs as much as possible. And then, as hard and as fast as you can, you will empty all of the air from your lungs through the mouthpiece. You'll keep exhaling forcefully for as long as you can, sometimes for several seconds, until you're told to stop. The test will end with another big breath in. Then, the technician will ask you to breathe in a dose of the medication called methacholine. This is done using a nebulizer, which is a machine that turns the methacholine into a fine mist that you'll inhale through a mouthpiece. After you inhale the medication for 20 seconds, the test is repeated at 30 and 90 seconds after the last inhalation. This pattern will continue with slight increases in the dose of the medication until there is a 20% or greater reduction captured on spirometry, or after 5 iterations, whichever comes first. You will then be given 4 puffs of albuterol to reverse any airway narrowing that may have occurred. It's normal to feel mild shortness of breath, chest tightness, or cough during the procedure, but if you are uncomfortable, be sure to let the technician know. During the test, your lung function will be monitored closely. Most of the time, the technician can tell if your airways are starting to narrow, even before you have any symptoms. Forced oscillometry technique is another type of pulmonary function test that helps your doctor understand how easily air travels through the smaller airways in your lungs. Like with routine spirometry, a soft clip will be placed on your nose, and you'll be asked to bite down on a clean mouthpiece and seal your lips tightly around it. Unlike the other testing described in this video, you don't need to inhale or exhale forcefully for oscillometry. Instead, you'll be asked to gently support your cheeks with your hands and breathe in and out of the mouthpiece normally for 20 to 30 seconds. You'll hear or feel gentle vibrations or puffs of air. These are harmless and part of the test. Try to stay relaxed and avoid talking or swallowing until the technician says the test is done. The test might be repeated a few times to make sure the most accurate results are obtained. The fractional exhaled nitric oxide test, or FeNO test, is another type of pulmonary function test that helps to measure the amount of nitric oxide in your breath. Elevated levels of nitric oxide can be a sign of a certain kind of airway inflammation. For this test, you will be asked to take a deep breath in and fill your lungs completely with air. Then, you'll place your lips around the clean mouthpiece of the FeNO device and breathe out at a steady, even pace, emptying out all the air from your lungs. It is important to maintain a steady exhale during the test to avoid having to repeat it. For FeNO testing, you will not need to inhale or exhale forcefully like for some of the other pulmonary function testing. Once you complete your pulmonary function testing, your results will be reviewed by your healthcare provider, who will discuss next steps with you. If you have any concerns about the process, you should discuss these with the ordering doctor beforehand. If you have other questions about your test, please visit My Healthy Vet online or contact your local VA pulmonary function lab or respiratory care department.